So, part 2, what are the actual risks of testosterone replacement therapy? Well, with healthy male androgen levels, there are no risks, hence healthy male androgen levels. But it's not quite as simple as that, obviously. We have to carefully titrate your dose according to effect to get your levels where they need to be. And you need to put the work in to keep them where they should be, and that is optimal. But if you're a chunky monkey, you will have an increased propensity to aromatization and therefore create more estrogen. And so your journey to optimization, aka normal, will be more arduous than the person that's already pretty healthy and just got low levels. So effort equals reward. So this titration process, this can be slightly emotional because for the first few weeks, you are going to get a drug effect, not the true effect of healthy testosterone levels, because you shouldn't really feel anything. You should feel normal. You should wake up and feel motivated to go earn your reward. But this first few weeks, what happens? Well, the HCG kicks in. Now that can cause you to feel amazing. Disappointingly, that's not going to last. You might feel anxious, and yes, reassurance, you're not going to feel like this forever. You might feel nothing. That doesn't mean it's not working. It just means you haven't had the drug effect. Then the testosterone builds up. And then we have to adjust the dose accordingly to get your levels optimal. Think of a graphic equalizer. If you're under 40, look at your dad's stereo. The bass goes down, and your body survives on this concept of balance, so everything else has to go down. And the basis being the testosterone. Then we've artificially raised the base back up, and because your body needs balance in order to function, hence the principles behind homeostasis, everything has to come back up, and that takes time. And if your journey to optimization is going to involve work, and yes, it's going to involve work, there can be side effects. So, outside of the obvious psychological ones, because obviously you've presented with an element of low mood, anxiety, depersonalization, and we've suddenly optimized you, just like that, magic. That journey can take a little bit of time. So you must trust the journey and understand that anything negative is only temporary. So let's break down each hormone. DHT, dihydrotestosterone. So what harm can come from excess DHT? Well, there is evidence that actually in excess, this can be linked to cardiovascular problems. But we don't ever get excess DHT because testosterone converts into DHT by 5-alpha reductase. So if DHT was elevated, testosterone would be elevated, and we'd adjust that. We don't have to worry about DHT. And for all you guys worried about going bald, it's genetic. Sort it out. Testosterone. No harm can come from high testosterone. Okay. Testosterone tells the kidneys to release EPO, which tells the bone marrow to produce red blood cells. And you can have anemia as a result of low testosterone. So obviously you want loads of red blood cells to combat that. Well, we want them to be optimal again. So red blood cells, they're a physical cell in the plasma being pumped around by that heart. And we don't want to stress the heart with thick blood. Because remember, more cells, thicker blood. Poor heart. Don't stress the heart. The blood vessel is friable. We don't want to pump syrupy blood around your cardiovascular system. Your lipid profile. So, high testosterone levels drops HDL. Now again, we understand the concept of balance, and we understand that cholesterol converts into pregnenolone, which then cascades down to cortisol, testosterone, and aldosterone, and a whole host of other hormones. So again, we want balance. We don't want excess. So we want to understand that LDL taking cholesterol to the cell and HDL taking cholesterol away from the cell need to have a healthy ratio. So with high testosterone, you get dysregulation of HDL and it drops. And that's a bit of a pain. So obviously it leads nicely on to estradiol, the favorite topic of the internet. Excess estradiol will make you anxious and emotional. We want you to be considered. We don't want you to be emotional. A proportional amount of emotion's good, because obviously when you had low testosterone, you've often felt pretty rubbish and pretty dead inside. But let's not be too emotional. It's necessary for your brain though. It is actually neuroprotective. Cardiovascular health. Again, estradiol is involved in the lining of the blood vessel. So again, you can really understand that excess estradiol might cause hypertension and water retention. Again, we don't want that, do we? Boobs. We don't want boobs. So, estradiol is excitatory to the breast, testosterone and DHT is inhibitory. So again, you can understand that these are 3 anabolic hormones, but they must all be in ratio for optimal well-being. Prostate health as well. Prostate needs testosterone, DHT and estradiol. Again, remember that hormones are the foundation. So what we see in prostate cancer is a low testosterone but a relative high estradiol. And we don't want that, do we? So it's not really a risk of high testosterone, but it's certainly worth mentioning in this video, because we have lots of doctors under my care. We have lots of scientists, lots of super intelligent people, perhaps more intelligent, definitely more intelligent than me, but they lack objectivity. They should be able to manage their own testosterone levels. They should be able to titrate their dose according to effect, but they lack objectivity. They don't want to be bothered about monitoring testosterone. They want to place that responsibility in somebody else's hands. So they place it in mine, and we carefully titrate the dose according to effect. And I'm essentially giving them pointers as to where they can improve things and applying that objectivity to their subjective experience. So, what am I going to say next? Yeah, you guessed it. Go earn your reward.